Welcome to this explainer. Today, we're exploring a really deeply important and, honestly, a very often misunderstood part of human development. We're going to dive into why a child's first encounter with loss is far more profound and far more clinically significant than we as adults often realize. You know, when a kid experiences death for the very first time, it is rarely just a small event for them. Yet we almost always misinterpret how they process it. So we're going to look at the fascinating science behind child grief, how their brains actually categorize the loss, and the precise evidence-based steps that caregivers can take to guide them through it.
Right off the bat, let's talk about a phrase we've all probably heard, or maybe even said out loud. It was only the hamster. It's totally well-meaning, right? But this common phrase completely misses the immense, totally unconditional relationship a child actually has with a family pet. You see, for most children, a pet is their absolute first experience with death. And what makes it so uniquely powerful is that this pet was often their most uncomplicated relationship. Think about it. There are no arguments, no conditions, just pure attachment. So when an adult says it was only the hamster, they're describing a loss that to a 6-year-old literally feels like losing a primary family member. Their grief is entirely real. It's not just some rehearsal for later in life.
And this brings us to a really crucial behavioral difference. If you've ever watched a child grieve, you might be kind of confused by their behavior. But there's this brilliant analogy that perfectly explains why. And it's this: grief in young children is a puddle, not an ocean. They step in, and then they step out again. Younger children grieve in bursts. A kid might cry incredibly hard for 10 minutes, just completely overwhelmed by sadness, and then suddenly stop, look at you, and ask if they can go play with their toys. Now, to an adult, this can look like they're just magically over it, but they aren't. That stepping in and out of the puddle is exactly what normal grief looks like at that developmental age.
Okay, let's move into Section 1, the science of child grief. To truly grasp what's happening, we need to zoom out from behavior and look at the actual clinical science.
What is super interesting here is how we can ground this whole emotional experience in hard science. Let's talk about prolonged grief disorder, or PGD. It's a distinct syndrome characterized by persistent disruptive yearning and trouble accepting a death present to the point of functional impairment beyond 6 months post-loss. Now, for a long time, the clinical significance of PGD was mostly just studied in adults, but recent major psychiatric studies of bereaved children and teenagers have proven that this distinct disorder absolutely applies to them too.
To put this into perspective, researchers conducted a confirmatory factor analysis study on bereaved kids aged 8 to 18. Before this, you might have assumed, and honestly, a lot of people did, that a grieving child's distress was just one big, jumbled mass of general sadness. But the data proved otherwise. The study confirmed that prolonged grief disorder, post-traumatic stress disorder, and depression are 3 entirely distinct clinical factors in a child's mind. They're totally separate constructs. A kid's brain doesn't just lump all bad feelings into one bucket. It actually processes the intense grief of loss as a highly specific syndrome, completely separate from depression or trauma. So what does this specific syndrome actually look like in real life? Well, the study found that certain intense symptoms strongly cluster together to form a unique indicator of PGD in kids. We're talking about a persistent yearning for the lost loved one, significant trouble accepting the loss, a profound feeling that a literal part of themselves died along with the loved one, and feelings of really intense anger or bitterness. These aren't just passing everyday thoughts. In a clinical context, these symptoms cluster together to form a highly unique and powerful emotional state.
And here is the absolute crucial takeaway, the so what of it all. What does this clustered emotional state actually do to a child's day-to-day life? The study showed that summed scores for PGD predict unique functional impairment in children over and above concurrent depression and PTSD. This validates that PGD isn't just some clinical label. It has an independent, real-world impact on a child's ability to function. When a kid is profoundly stuck in their grief, it is a highly specific condition requiring careful understanding. It's for sure not just a phase to be brushed off. Which brings us to Section 2, what helps and what hurts. Knowing all this science, how do we practically handle this in our own living rooms? Let's look at one of the most common mistakes adults make. And the contrast here is just stark. On one side, we have euphemisms: put to sleep, went away, lost. On the other side, the real words: died. Listen, it is incredibly dangerous to use euphemisms with young children. If you tell a kid their dog was put to sleep, you risk creating a child who becomes absolutely terrified of going to bed at night. If you say they went away, you create a kid who waits by the front window for them to return. The safest, most helpful approach is to just use factual, real words. Saying died might feel super harsh to us as adults, but it provides the necessary clarity and safety for a child's developing brain.
So let's build on that.
What do sequentially healthy coping mechanisms actually look like? Step 1, as we just covered, is use the real words. Step 2, let them mark it, creating a ritual like a small burial in the backyard, drawing a picture, or even just keeping a special box with the pet's collar, gives their massive, shapeless feelings a physical job to do. It provides a tangible outlet for that puddle of grief they're stepping into. And step 3, which is probably the most critical, you absolutely have to answer the question underneath.
You see, when a kid asks about a death, they are almost always hiding a much larger, much more personal fear. The true underlying question they are actually asking beneath all that grief is this: will that happen to you? They've just realized that things they love can disappear permanently. So while they might be talking about the hamster or the cat, they are actually testing the security of their entire world. Caregivers really need to recognize this and address it directly and calmly. Offer reassurance about your own presence and health, rather than just talking exclusively about the pet.
Now we come to the one thing that reliably makes it all worse: the replacement pet. Let's be totally honest, it is incredibly tempting to just rush right out to the pet store and grab a new puppy on the way home to stop the crying. But doing this creates a really dangerous loop payoff. Rushing in a new animal to shortcut the sadness explicitly tells a grieving child that a loved one is entirely interchangeable. And worse than that, it quietly teaches them that big, uncomfortable feelings should just be gotten rid of or distracted away from, rather than actually felt and processed.
Moving into Section 3, when to seek support. Because we need to know exactly when those normal, everyday puddles of grief transition into something that requires a different level of care.
So here are the specific red flags that indicate professional support is needed. If the grief is stopping a child from eating, stopping them from sleeping, causing them to completely refuse to go to school after several weeks, or actually, if it turns into this persistent, paralyzing fear about losing you, that is when it is absolutely time to seek clinical help. These are major indicators of functional impairment. But remember, as a caregiver, you should never try to diagnose the child yourself. Your job is simply to observe these specific behavioral shifts and connect them with the professionals who can help them process it.
As we wrap up this explainer, I really want to leave you with a final thought to reflect on. When we use euphemisms, when we rush to buy a replacement pet, when we minimize their loss by saying it was just an animal, are we protecting our children from grief, or are we just protecting ourselves from their sadness? Truly understanding the science of childhood loss means having the courage to let them feel it, giving them the real words to understand it, and just standing patiently by the puddle while they step in and out. Thanks so much for joining me on this explainer, and I hope this really changes how you view a child's first encounter with loss.